Dear students, in this video we are going to see few important bony landmarks and the structures attached to those landmarks. Number 1, this is anterior superior iliac spine and this is anterior inferior iliac spine. So, from anterior superior iliac spine there are two attachments. One is sartorius, one muscle, that is sartorius. Another one is the ligament called inguinal ligament. Inguinal ligament, the attachment of inguinal ligament is, we'll see, this is pubic tubercle, the projection is called pubic tubercle, the center one is called pubic symphysis, and the in between these two you have the pubic crest. Okay. So, what we want is important things. Number 1 is anterior superior iliac spine and anterior inferior iliac spine we have done. Anterior inferior iliac spine. Now, for anterior superior iliac spine you have two important structures. One is the muscle sartorius which is attached to that. Another one is a ligament called inguinal ligament. The attachment of inguinal ligament is anterior superior iliac spine to pubic tubercle. Okay, not symphysis, it is pubic tubercle. So, again I will draw anterior superior iliac spine to pubic tubercle is the ligament. Okay, this is about the inguinal ligament. Inguinal. So, there are two structures, one is sartorius, another one is inguinal ligament which are attached to the anterior superior iliac spine. In the anterior inferior iliac spine you have two structures, one is iliofemoral ligament, that is strongest ligament, and the second one is straight head of rectus femoris. So, these two are attached to the anterior inferior iliac spine. So, we have done with anterior superior and anterior inferior. And next is what is called mid inguinal point. Mid inguinal point is the point between anterior superior iliac spine and pubic symphysis. Symphysis is in the middle. So, between these two is the point called mid inguinal point. Just below the mid inguinal point you have the artery, femoral artery. So, the location of femoral artery is midway between the anterior superior iliac spine and pubic symphysis. That is about the important points here. And next comes your acetab, this is operator foramen. This foramen is called operator foramen and this arch is called subpubic arch. And here this is the highest point of iliac crest and this is called iliac tubercle. The tuberosity corresponds to L5 and highest point of iliac crest corresponds to L4. These two are MCQs here. This is called iliac fossa. Iliacus muscle gets its attachment here in the iliac fossa. So, these are the few important facts in this picture. I will erase all the stuff. Next, we will move on to the next area and MCQs related to that. Okay. Here almost we have seen everything. The next important thing is, okay, this one. This is called greater sciatic notch and this is called lesser sciatic notch, and from the sacrum to the ischial spine, this is called ischial spine. From the sacrum to the ischial spine, this is called sacrospinous ligament. Okay, sacrospinous ligament. And from the sacrum to the tuberosity, this is called ischial tuberosity. From this to this, that is called sacrotuberous ligament. Okay, we can draw it here. So, the sacrospinous ligament converts the greater sciatic foramen into notch into a foramen. Okay. Like that, sacrotuberous ligament converts the lesser sciatic foramen into a notch into a foramen. So, I will erase these two. So, you should know about what is greater sciatic and what is lesser sciatic. In between these two is a ischial spine. This ischial spine is very important because it is three structures cross this ischial spine. One is pin, that is called pin structure. One is pudendal nerve, P for pudendal nerve, and I for internal pudendal artery, and N for nerve to obturator internus. Okay, these are the three structures which cross the ischial spine. So, it is very important. And greater sciatic foramen, the structures present inside the greater sciatic foramen are superior gluteal artery, above superior gluteal nerves, okay, and then piriformis is a muscle which divides the structures above and below. Below you have inferior gluteal nerves and inferior gluteal vessels, sciatic nerve. Along with the sciatic nerve, we have posterior cutaneous nerve of thigh. So, these are the structures along with pin structure. Pin already I have explained. All these structures, they pass through the greater sciatic foramen. Now, structures passing through the lesser sciatic foramen. Through the lesser sciatic foramen, only pin structures, PIN. These three structures alone, they come through the lesser sciatic foramen. So, lesser sciatic only pin. Greater sciatic along with pin, I have told other nerves also and vessels. So, this is about greater sciatic and lesser sciatic foramen and notch. Next comes the gluteal lines. You have the posterior gluteal line, you have the anterior or superior gluteal line, you have the inferior gluteal line. So, sacrum, sacrotuberous ligament, sacrospinous ligament, everywhere till this is called posterior gluteal line, this is called anterior gluteal line, this is called inferior gluteal line. Okay, so here is the attachment of gluteus maximus. So, gluteus maximus takes its origin entirely. Okay, then between the posterior and anterior, you have the gluteus medius, and between the anterior and inferior, you have gluteus minimus. All these three are MCQs. So, below this groove above the acetabulum, there is a groove above the acetabulum. Here you have the origin of reflected head of rectus femoris. So, it is very important. Reflected head of rectus femoris takes its origin just above the groove above the acetabulum. This is called acetabulum. Just groove above the acetabulum, it gives origin to the reflected head of rectus femoris. So, these are the few origin of the few attachments of the muscles of hip bone. Okay. Next comes here also same thing, posterior gluteal line, and if you these are the lines. So, we have gluteus maximus, gluteus medius and gluteus minimus. Okay, minimus and medius maximus. Now, you have one important muscle which divides it, that is called piriformis. Above the piriformis, you have superior gluteal nerves and vessels, and below the piriformis, you have inferior gluteal nerves and vessels. So, all these are MCQs. Now, where do you give the injection? Injection to be given, intramuscular injection to be given in the upper outer quadrant. It means this area. So, this area is the attachment of gluteus medius and minimus. So, this is the area where you give the intramuscular injection, gluteus medius and minimus. But you are not supposed to give the injection in the lower quadrant, because you may injure the important nerve, sciatic nerve. That is very important. So, these are the important points here. So, that is about the important bony landmarks here. Now, obturator foramen is here. Through the upper superior lateral aspect, you have the obturator nerve emerging out through this foramen. This is covered by obturator membrane, and outside you have the obturator externus muscle, and inside you have obturator internus muscle gets its attachment, and this is acetabulum. That is all about the attachments and important points related to this bone.